So our objective is that you never present this graph, or this one, or this one. What we'd like you to do is, at the end of this session, be able to plan a presentation based on your audience, to select effective visual display of your data, and to be able to anticipate questions and be able to incorporate them into your presentation. So Edward Tufte is an expert in the presentation of informational graphics, and he always recommends that you provide a handout when you do a presentation. So this is your digital handout. You can print it off when you get home. This will be in your reference guide. This is Dr. Abella's work, and he reviews the steps that you need to consider when you're presenting. First step, know your audience. So are you going to be presenting to nurses, surgeons, quality team? Because your data is going to look different depending on who you're going to present to. You want to be able to determine your message. What is it that you want your audience to get out of your presentation? Hopefully you're speaking on a topic that you have great interest in or great expertise. You want to be able to determine the scope of your topic. You want to have the right amount of information for the time that you've been allotted. Are you going to be presenting a summary to faculty? Are you presenting your SAR results? That's going to look very different from a presentation where maybe you're updating a team on the results of your CAUTI work. You want to understand your data. Does it provide important, meaningful, and useful insights? Is your data risk adjusted? Because if you're presenting to surgeons, they're going to ask that question. This is one of the first graphs that the ACS provided for us so that we could learn what it means to have risk-adjusted data. So on the left, it shows a hospital that thinks they're doing well. After their data is risk-adjusted, they're not doing as well. You might want to include a graph like this in your presentation if you think you're going to get a question about risk adjustment. You're welcome to borrow. Do you want to engage your audience? Can you make your presentation interactive? Can you say iClicker? So if you don't have iClickers at your institution, you can try the low-tech method. Raise your hand if you use iClickers in your presentations at your institution. Okay. You want to determine your story. What's the story you want to tell with your presentation? At our institution, we implemented ERAS. Our colorectal surgeon, Tracy Hedricks, was very successful. We reduced our readmission rate. First time we prepared this slide, we just showed all patients, but what were the surgeons going to ask? Oh, is it the same in laparoscopic and open? And you can anticipate what our next slide was. Well, you've reduced length of stay, but what about readmissions? So you want your data to be clear, straightforward. The other thing is, if you've seen presentations today where you like the graphs that have been displayed, go ahead and jot it down. That worked really well. I've seen several graphs that I'm going to start using, things that, very clear, you look at the data and you say, that was a good representation. I've seen a couple other that I am sure I will not use. So if someone looks at their data and says, this is really busy, or I know you can't really understand, don't use that slide. Revise it, parse it down. It's really important to have the best display of your data. You want to explore that. This is the same data 3 different ways. So right-click and change chart type, 2 seconds to change the way that your graph is displayed. And the pie chart just doesn't cut it. The next step is to create your PowerPoint, and realize this was not your first step. So you really want to think about your message, how you want to display your data, then get to opening up your PowerPoint. And I think that's the mistake that I made. I started off and I just started making graphs, and I didn't really think through, what am I trying to say with this? So note that you have many different templates you can choose from. This is 2013. It goes back to 2010. You can go on the website and open up any of the conference presentations and get a good template. And a shout out to Steve Kenny, the IT. 2014 presentations are already on the website. So you have lots of good examples. And it's always going to take longer than you think. So you want to practice. If you have a chance to present locally before you have to present nationally, that helps. If you have a chance to present at a staff meeting before you have to be in a faculty meeting, that helps. For the first time, I've been presenting data since 2003. This is the first time I've been done in advance so that I could actually send my presentation 2 weeks in advance to a colleague and say, could you review this? Could you give me feedback? You might just want to choose one slide as you're walking down the hall. Ask someone, do you have a question? After looking at this one graph, do you have a question? And if they have a question, revise and incorporate it into your presentation.